Welcome to Smartlife. I'm Derek Lata.
And I'm Kathy Buccio. We are here at the Baptist Health South Florida studios.
And joining us to explain what the flu is and how to stay healthy is Dr. Yvonne Johnson, the Chief Medical Officer at South Miami Hospital. Welcome to Smartlife.
Thank you for having me.
Great having you. Now, who's most at risk for catching the flu, Dr. Johnson?
Influenza is a very easy virus to catch. It spreads very easily, so we're all at risk of catching the flu. What is different is who's at risk for the complications of the flu. So certainly people who are young, the very young, under 5 and particularly under 2. The older, I hesitate to say very old anymore because I don't think...
We don't know what that is anymore.
I don't think 65 is very old anymore. I still think of it as pretty young. But those who are 65 and older are at greater risk of complications of the flu. Certainly people who are immunocompromised in some way, whose immune system is compromised, if they have cancer or if they're on some type of chemotherapy, or have chronic illnesses. So people who have COPD or chronic heart disease, they're at a much higher risk of having complications of the flu. But all of us are at risk of catching the flu.
And to reduce those risks of catching the flu, I've heard about vaccines. Is that correct?
So that's getting your flu shot is probably one of the most common things that we try to encourage everyone to get, because even if you're not at high risk of the complications of the flu, you're at risk of giving it to someone else. So we really do encourage everyone to get the flu shot, but in particular those groups of people that I mentioned who are at high risk of complications, and that even includes pregnant women.
I want to bring this one up though, Dr. Johnson, because I don't know, Derek and I'm sure you have as well. Why do I need the flu shot? Every time I get the flu shot, I get the flu.
Correct.
Yeah, I think that's a misnomer. I think people have had an incident where it was a coincidence that they ended up with either symptoms of a cold or of some virus in close proximity to when they got the flu shot. But there's really no clinical evidence that the flu shot causes the flu.
Okay.
But in addition to getting a flu shot, one of the best things that we can all do to prevent getting the flu is washing our hands.
So basic,
you know,
so important.
Exactly, it's basic, but we know in the hospital with all infections that we reduce the incidences of infection when we wash our hands very frequently. So in our homes, as soon as you come home, you should wash your hands. We should try to avoid touching our faces. You should make sure that you're washing your hands before you eat. You know, you don't want to share a lot of paraphernalia like glasses and towels and those kinds of things, especially if you have somebody at home who does have the flu. So those are some of the common things. But yes, washing the hands is top of the list of how you can prevent yourself from getting exposed.
And that helps you minimize hepatitis A as well, washing your hands.
It does, absolutely.
You mentioned a cold earlier. What's the difference between a cold and a flu? What are the symptoms of a flu?
That's got to be a really common question.
Yeah. Well, it's funny because a lot of us equate them, and we get cold symptoms. Say, oh, I had the flu last week. It's sort of in my mind like when we say we're starving. When we just mean we're hungry. It's really not, the same. So, that's kind of the analogy that I think of. So cold is a virus, also usually caused by some type of a virus, and you have symptoms that are similar, where you might have a runny nose or a brief sore throat or a cough, but it's mild generally, and you can continue on with your life. You go on with your day, and you might be a little fatigued. Real influenza, when you have symptoms of the flu, influenza, it hits you like a Mack truck. So you could typically you were feeling well, and you can tell to the almost minute when you started feeling badly. So when people tell me come into the emergency room and they are having flu symptoms, and I say, well, when did you start feeling bad? 2 o'clock, right after I got back from lunch. I mean, they can pinpoint the time. It's you were feeling well, and then all of a sudden you were feeling really badly. And in those symptoms of feeling badly, you're fatigued, you generally have fever, body aches.
To the touch, I know that when I had the flu, the moment you even touched me, I was in pain.
It hurts to touch, your joints ache, you don't even have to be touched, just your muscles and your joints ache. And one of the things that I tell people is, you feel like you're going to die, and the only problem is, you're not. It's like, that's how badly you can feel, and you typically feel when you really have influenza. And then, we have to be concerned about some of the sequelae of influenza, or some of the things, the complications that can happen. So, most of us who are generally healthy, we can survive influenza. You stay home. We ask that you stay home so you don't spread it.
Okay. So most of us can ride it out?
Most people can ride it out. You feel badly, you can take things like Tylenol or ibuprofen to reduce some of the symptoms of the achiness.
Okay.
You want to stay really well hydrated, that you're drinking really a lot of water and liquids, that you're getting adequate amounts of rest, and staying home is really a good idea.
And when should we go to the emergency room?
So, again, some of us don't really need to do much of anything if our symptoms are not that dramatic. But if you are having symptoms that are very severe, or you really just need to reduce those symptoms or reduce the time that you're going to be sick, and frankly, most of us can't afford to take off from work for 2-3 weeks at a time. So we really do want to feel better sooner. If you can get on to some antiviral medicine.
Is that the Tamiflu that you get on?
Exactly.
I mean,
there's different brands of antiviral medicine. That's one of them. But you want to contact your doctor as soon as possible, because you want to be able to get on the medicine within 48 hours.
Any final tips, doctor, that you can share with our viewers on how to stay healthy and in flu season? I mean, overall, but particularly in flu season, no one wants that.
Exactly. So I think that we talked about, the most important thing, which is really washing your hands, making sure you're getting adequate rest, getting good exercise and eating well, isolating yourself from people who are having symptoms, of the flu, and not sharing items that would, it's body fluids like, saliva and air particles when you're coughing. So, it's helpful that you cover your face when you are sick, and so that you're not spreading it, and that you're not exposing yourself to other people's cough. Really hard, especially for folks who have children. They seem to always manage to cough right in your face, and it's almost an impossibility.
My 4-year-old is a pro at that, by the way.
Absolutely, and it seems that when they go to school, no matter what age that is, when those first couple of years that they go to school, they're going to catch it.
Yes,
and
it's
if
really
you're
fun in my
home with
house.
it,
I'm sure.
It's likely that you're going to catch it. But those are the kinds of things you can do, is try not to share with them as best you can.
And wash your hands.
And wash your hands.
Wash your hands.